Welcome to today's video lecture. Today, we're going to delve into a fascinating topic, gastroesophageal reflux disease. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will delve into the intricacies of gastroesophageal reflux disease, including its etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of gastroesophageal reflux disease and its impact on patient care. So, let's begin. GORD, or gastroesophageal reflux disease, is a chronic condition characterized by the reflux of gastric contents into the esophagus, resulting in symptoms and complications. GORD is caused by the malfunctioning of the lower esophageal sphincter, or LES, a muscular ring that normally prevents the backflow of stomach contents into the esophagus. When the LES is weak or relaxes inappropriately, stomach acid, along with partially digested food and digestive enzymes, can flow back into the esophagus. This reflux of acidic gastric contents irritates the esophageal lining, leading to various symptoms and potential complications. The lower esophageal sphincter, LES, is a muscular ring located at the junction between the esophagus and the stomach. Its primary function is to prevent the reflux of stomach contents into the esophagus. In individuals with GORD, the LES is weakened or dysfunctional, allowing the backward flow of gastric acid, bile, and digestive enzymes into the esophagus. There are several factors that contribute to the development of GORD. LES dysfunction. The primary cause of GORD is a malfunctioning LES. Normally, the LES contracts and maintains a high-pressure zone to prevent reflux. In GORD, the LES may have reduced tone or relaxes inappropriately, allowing reflux to occur. Hiatal hernia. A hiatal hernia is a condition in which part of the stomach protrudes through the diaphragm into the chest cavity. This anatomical abnormality can weaken the LES and contribute to GORD. Impaired esophageal clearance. The ability of the esophagus to clear refluxed acid and gastric contents back into the stomach is crucial in preventing GORD. Impairments in esophageal motility, such as ineffective peristalsis or delayed gastric emptying, can result in prolonged contact between the esophageal mucosa and the refluxed contents, leading to symptoms and esophageal damage. Acidic gastric contents. Gastric acid plays a significant role in the pathogenesis of GORD. Acid is highly corrosive and can cause inflammation and injury to the delicate lining of the esophagus. In addition to acid, other components of gastric juice, including bile salts and digestive enzymes, can further contribute to esophageal mucosal damage. The refluxed contents irritate the esophageal mucosa, leading to inflammation, tissue damage, and the development of symptoms. Chronic exposure to acid can result in erosions, ulcerations, and changes in the cellular structure of the esophageal lining. In some cases, this chronic irritation can lead to complications such as esophageal strictures, narrowing of the esophagus, Barrett's esophagus, a precancerous condition characterized by abnormal changes in the lining of the esophagus, and even esophageal cancer. When assessing a patient for gastroesophageal reflux disease or GORD, you would consider the following clinical presentations. Heartburn. This is the most common symptom of GORD. Patients typically describe a burning sensation or discomfort in the chest, often behind the breastbone, sternum. It is commonly experienced after meals or while lying down and may worsen with bending or stooping. Regurgitation. Patients may complain of the sensation of food or stomach contents coming back up into the throat or mouth. It may be accompanied by a sour or bitter taste. Regurgitation can occur both during the day and at night, often worsened by lying flat or bending over. Dysphagia. Some patients with GORD may experience difficulty or discomfort while swallowing. This can present as a feeling of food getting stuck in the throat or chest. It may be more pronounced with solid foods. Odonophagia and chest pain. GORD can cause pain or discomfort during swallowing. Patients may describe a sharp or burning pain in the chest or throat while eating or drinking. GORD can mimic heart-related chest pain, angina. The pain may be mistaken for a heart attack, especially if it is intense and radiates to the arm, neck, or jaw. However, it typically lacks the characteristic features of cardiac chest pain and is often relieved by antacids or positional changes. Chronic cough. Some individuals with GORD may have a persistent cough that is not responsive to typical cough remedies. The cough may worsen when lying down or at night. Diagnosing gastroesophageal reflux disease, or GERD, typically involves a combination of clinical evaluation, patient history, and, if necessary, additional diagnostic tests. Here's an overview of the diagnostic process for GERD. Medical history and physical examination. Begin by obtaining a detailed medical history from the patient. Ask about their symptoms, duration, frequency, and any factors that worsen or alleviate them. Inquire about lifestyle habits, dietary patterns, medication use, such as non-steroidal anti-inflammatory drugs or calcium channel blockers, and any previous treatment attempts. Perform a thorough physical examination, focusing on the chest, abdomen, and throat. Look for signs of acid reflux, such as dental erosions, throat redness, or chest tenderness. Symptom assessment. Evaluate the patient's symptoms using validated questionnaires, such as the Gastroesophageal Reflux Disease Questionnaire or the Reflux Symptom Index, RSI. These tools can help assess the severity and impact of GERD symptoms. Empiric treatment. In some cases, if the clinical presentation strongly suggests GERD and the patient's symptoms are not severe, a short trial of empirical treatment with acid-suppressing medications, such as proton pump inhibitors or H2 receptor antagonists, may be initiated. Improvement in symptoms with treatment supports the diagnosis of GERD. Diagnostic tests. If the diagnosis remains uncertain or if the patient does not respond to empirical treatment, further diagnostic tests may be necessary. These can include upper endoscopy, esophagogastroduodenoscopy. This allows direct visualization of the esophagus, stomach, and duodenum. It can identify complications of GERD, such as erosive esophagitis, strictures, or Barrett's esophagus, and rule out other potential causes of symptoms. Esophageal pH monitoring. This test measures the pH level in the esophagus over a 24-hour period. It can help confirm the presence of acid reflux and assess the frequency and duration of reflux episodes. Esophageal manometry. This test evaluates the function and coordination of the esophageal muscles. It can identify motility disorders that may contribute to GERD symptoms. Barium swallow. Although less commonly used, a barium swallow can detect structural abnormalities in the esophagus and evaluate the movement of food and liquid. The treatment approach for GERD typically involves a combination of lifestyle modifications, medications, and, in some cases, surgical interventions. Here's an overview of the treatment options. Lifestyle modifications. Dietary changes. Encourage patients to avoid trigger foods and beverages that can worsen symptoms, such as spicy foods, citrus fruits, tomatoes, fatty or fried foods, chocolate, caffeine, and alcohol. Smaller, more frequent meals and avoiding eating close to bedtime may also be beneficial. Weight management. Encourage patients with excess weight to lose weight through a combination of a healthy diet and regular exercise. Weight loss can help alleviate GERD symptoms. Elevation of the head of the bed. Advising patients to elevate the head of their bed by 6-8 inches can help reduce nighttime acid reflux symptoms. Avoidance of tobacco smoking. Encourage patients to quit smoking, as smoking can worsen GERD symptoms and delay the healing of esophageal tissue. Medications. Over-the-counter antacids, such as calcium carbonate or magnesium hydroxide, can provide temporary relief by neutralizing stomach acid. They are best suited for occasional or mild symptoms. H2 receptor antagonists, H2 blockers, medications such as ranitidine or famotidine work by reducing the production of stomach acid. They can be effective for mild to moderate GERD symptoms and are available over the counter or by prescription. Proton pump inhibitors, PPIs. These medications, such as omeprazole or esomeprazole, are highly effective in reducing acid production. They are typically prescribed for patients with moderate to severe GERD or those with complications like erosive esophagitis or Barrett's esophagus. PPI are available in both over-the-counter and prescription strengths. Prokinetic agents. In certain cases, prokinetic medications like metoclopramide or domperidone may be prescribed to improve esophageal motility and reduce reflux. Surgical interventions. Fundoplication. In patients with severe or refractory GERD, surgical intervention may be considered. Fundoplication involves wrapping the upper part of the stomach, fundus, around the lower esophageal sphincter, less, to reinforce its closure and prevent acid reflux. Endoscopic procedures. Minimally invasive endoscopic techniques like transoral incisionless fundoplication, TIF, or radiofrequency ablation, STRETA procedure can be used to tighten the LES and improve symptoms. In conclusion, understanding the clinical presentation, diagnostic evaluation, and treatment options for GERD is very essential. By diagnosing and managing GERD effectively, we can improve the quality of life for our patients. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.